Hello everyone, hope you all are doing great. So today we will be discussing about the very important topic of pharmacology too, that is the mechanism of beta blockers. Okay, we will also be discussing about its pharmacokinetics and uses. So what are beta blockers? As in the name itself, blockers. So these are the agents or drugs that act by blocking the action of certain hormones in your nervous system, for example adrenaline. Now by doing this, they obviously will prevent the activation of your flight and fight response, that is your stress response. If the body is releasing high levels of adrenaline, so the patient or the person may experience rapid heartbeat, high blood pressure, excessive sweating, uh, anxiety, heart palpitations, etc. Now when this blocking agents will block block the receptor, this hormones which will be inhibited will lower the stress automatically of the heart, reduce the blood volume, and thereby reducing its force of contractions, right, of the heart muscles. Now let's see a few examples of your beta blockers. So we have beta blockers classified as non-selective, mixed, intrinsic activity showing, cardioselective, etc. So the important examples of your beta blockers are your propranolol, timolol, sotalol, atenolol, okay, bisoprolol, esmolol, pindolol, cardiolol, labetalol, carvedilol, etc. Okay, let's move ahead to the very important part, that is the mechanism of action. Now in this mechanism of action, this is the beta receptor. Okay, now what is happening, the non-epinephrine binds to the beta receptor, and as the beta receptor is G protein coupled receptor, it activates the G protein coupled receptor. That means when the non-epinephrine is binding to the beta receptor, it will activate G protein coupled receptor. Now due to the activation of G protein coupled receptor, this will lead further to activate the adenylyl cyclase. Now this adenylyl cyclase will convert the ATP to cyclic AMP. Okay, so after this, the cyclic AMP activates the protein kinase, and this protein kinase undergoes phosphorylation, which phosphorylation of your L-type calcium channels, which initially releases the calcium into the intracellular cell, or it passes or it goes inside the calcium channels and lead to the contraction. Okay, so this is the basic mechanism which is going inside the body, which is undergoing the cardiovascular disorders. Generally your hormone or your neurotransmitter norepinephrine is binding to the receptor. As beta receptors are G protein coupled receptors, it is leading to the activation of adenylyl cyclase, which is converting your ATP to cyclic AMP, which cyclic AMP further plays a role of converting or formation of your activation of protein kinase, which is phosphorylate, okay, which is phosphorylated, and which occurs a phosphorylation of your L-type calcium channels. So the calcium from the calcium channel comes inside the intracellular membrane of the cell and lead to the contraction. Now what happens when the beta blocker receptor will bind to the beta receptor, we'll see. Okay, यहाँ तक contraction हो रहा है. Now this contraction is what we do not need. That's why we are giving the drug beta blocker. Okay, simply the action or the principle behind beta blocker is what we have to inhibit the contraction. So how? Let's see. So here you can see the beta blocker. Okay, the beta blocker which was here now binds to the beta receptor, that is it inhibits the action of your non-adrenaline, okay, non-epinephrine. So the non-epinephrine which was binded to the beta receptor, the beta blockers inhibit the contraction by binding to the beta receptor. So these beta blockers are, any of your drug, atenolol, propranolol, or sotalol, etc., bind and block the action of the beta receptor. Now, when this beta blockers bind, what happens is the entire process is stopped, because now the non-epinephrine which was initiating the activation of G protein, adenylyl cyclase, and further this all is blocked. Okay, because of the first step itself was blocked, the receptor itself was blocked, so the further mechanism is stopped. And if further mechanism is stopped, we know the contraction will not happen, and thereby it will occur the relaxation. Okay, as there is an inhibition of contraction, relaxation occurs, which will lead, or which will help, or it will prevent the cardiovascular diseases. Okay, so let's see what are the pharmacokinetic of beta blockers. It is well absorbed after oral administration. Propranolol extensive goes under first pass metabolism, that why it has low bioavailability. Beta blockers are primarily metabolized by liver. Water soluble beta blockers, example atenolol, are excreted unchanged via kidney. And lastly, the uses of beta blockers. So yes, it is used in the cardiovascular disorders such as your hypertension, angina pectoris, myocardial infarction, and your congestive cardiac failure. So the conclusion here is the beta blocker inhibits the contraction and initiates the relaxation, which is used in the treatment of cardiovascular diseases. Thank you, everyone.